We see in our reports how concerning and a continuing problem this is around the world. We're approaching 1 million infections, but how worse could this yet get?
I think we're still on the way up in this pandemic. I think Europe may be soon reaching a peak, but for other countries it's still very much beginning. And I think you've seen in your previous packages the potential for this disease in vulnerable populations in Africa, in refugees and in other vulnerable people around the world.
Is testing still key? Is that the message from the World Health Organization, or is it simply being overwhelmed now by the sheer amount of people falling ill?
Testing is important, but I think, and you see so many countries in Europe in lockdown, and many developing countries putting lockdowns in place, or shutdowns. In a sense, we're putting people in their homes, we're shutting down schools and restricting movement. In a sense, that's a desperate move in order to try and suppress infection. But in order to get out of that, we have to put in place the public health measures, the case finding, the contact tracing, the isolation of cases. We've got to match our investment in the health service with our investment in public health. You've seen in Singapore, you've seen in places like Hong Kong and China and in Japan. We can reach control of this virus. We may not get rid of it completely, but we can reach a point where we can control the virus and live with it and get our economies and our social systems back on track. In order for that to happen, we have to use the time now that lockdowns are providing to put in place those comprehensive strategies. And I think Ireland is doing a pretty good job at that right now.
Yes, I was going to ask you, bearing in mind the lockdowns, shutdowns, whatever term people are using around the globe, what's your view of the Irish approach and the approach the Irish government are taking?
I think Ireland has taken a very measured approach. It's built its strategy. I think they've always focused in on both the public health, the case finding, the contact tracing, and on strengthening the health service. Nothing in life is perfect, and we've all been surprised by the severity of this virus. We've all been surprised by the speed of its spread. But I think maintaining that dual approach, strengthening the health service to save lives, strengthening the public health service to find the cases and go after the virus, having a defensive strategy to save lives and an offensive strategy to go after the virus is a good mix. I really would like to commend people in Ireland, the communities in Ireland, who have really taken on board this. They're looking after themselves, they're looking after each other, and I'm proud to be an Irishman watching the way in which communities in Ireland have embraced, listened and acted to protect themselves and protect others.
And I've no doubt many people will be pleased to hear you saying that tonight. In terms of the virus, have we learned anything more about it in the past few months? Do we know anything more about going and tackling it?
Well, I think we're all learning that this virus is very, very severe in mainly older populations or people with underlying conditions. But we've also seen, and you've seen some tragic evidence in the last few days, that this disease can be very severe in younger age groups. And 15 to 20% of people being admitted to hospital around the world, or 15 to 30%, are people under 50 years of age. And we've seen tragic deaths in teenagers. So we need to, while understanding that this disease is affecting our older, our most cherished, our most wise people, it is also affecting all age groups. The other thing we're seeing is the virus is stable. The virus is not mutating. The virus is not adapting or altering. It is spreading in a very systematic way, and it's spreading along those chains of transmission between people. We have got to break the chain. We know we can break these chains. The virus is very efficient at spreading, and it may stay ahead of us, but it is way too far ahead of us now. We've got to even up the stakes here, and we've got to break chains of transmission. We do that by stopping the chains of transmission, by protecting ourselves, protecting those around us, and listening to what public health and government officials are telling us. In Ireland, I think the government have done a very sound job in communicating and in setting up a strategy that works. Nothing is perfect, things change every day, but I think Ireland is, and you look around Europe at the situation in other countries, I think Ireland can say that it's doing well.